This is an gynecological ultrasound of a 35 years old hairless female with the history of lump felt in the region of the right lower abdomen. This is the uterus in transverse section, and this is the uterus in longitudinal section. There is no history of any menstrual disorder. No history of cesarean section or surgical intervention in the past. This is the uterus. This is the endometrial canal. These are the anterior lip of the cervix, posterior lip of the cervix. This is the outer surface of the uterus, and the uterus is normal. Okay. Now here what you are seeing is the left ovary with follicular activity seen within. This is the left ovary. And the tiny cystic areas that are seen within, this one, this. These are the developing follicles. Now, in the region of the right adnexa, we see this is the mass, a solid mass. Central cystic area. This is the central cystic area. This is the echogenic mass, dense coarse echogenic, weighing approximately 10 into 6 centimeters, and here you see this is the uterus. This is the fundus of the uterus, the endometrial canal, the urinary bladder, and this is the mass. Now this mass extends from the region of the right adnexa, is separate from the fundus of the uterus, is separate from the uterus. This is the uterus, and this is the mass. You can see that it has no relation. This mass has no relation, pelvic mass has no relation with the uterus. The right ovary is not visualized. So this mass has internal echogenic areas, as well as a few tiny calcifications. These are the tiny calcified areas within it. This is the transverse section of the mass. Here you can see that posterior shadow is seen from this dense coarse echogenic area. And this mass extends from the region of the right adnexa up to the lumbar region. In the midline, here I am, and also expands in the region in the right lower abdominal quadrant, with iliac vessels seen coursing posterior to it in this region. These are the iliac vessels, these are the iliac vessels, this is the mass. This is the iliac vessel. This is the mass. See the internal cystic area. This is the tiny cystic area internally. This is the calcification, and This is a solid mass with no posterior wall acoustic enhancement, islands of echogenic areas. This is a rounded echogenic area with no posterior shadowing, and here you can see multiple anechoic areas within the cystic area. So this is in fact a complex cystic. This is a complex mass that extends from the right pelvic cavity, right adnexa, in the midline up to the umbilical region, and expands up to the right lower abdominal quadrant here. This is the right lower abdominal quadrant. Here it is in the region of the right adnexa, here, and here it goes up to the umbilical region. This is the transverse section. So this is a complex mass, solid, with internal cystic and solid areas as well as calcification, with iliac vessels coursing posterior to it. The region of the right lower abdominal quadrant. There is no fluid seen in the pelvic cavity. The right ovary is not visualized. So I will suffice with the findings, and if you note one more finding, that is that this echogenic area is surrounded by thin fluid rim around. So this will require surgical intervention, and its exact nature will be defined by the biopsy. And this solid echogenic area gives no mass effect. Thank you.